Good afternoon. Get in here, get in here. If we have a friend who is breastfeeding a newborn, I just want to talk to parents. And this is a question I'm having so many times, like, how do I tell my baby is breastfeeding? How do I tell my baby is having enough? How do I tell if I am producing enough milk? All right. And let's bear in mind that our boobies come in all shape and sizes. I have two here, very different. One is big, one is small, and they have to feed a baby. And yeah, I have a baby here. So which breastfeeds what more? When should I top up? Should I introduce formula milk? Should I introduce cow's milk? Should I introduce uji? So we want to discuss that. That is what I want to discuss because I've seen at this time, and when mothers are really afraid of getting to the hospital and to ask any question at this time, I think because of the pandemic or something. Please share with us your fears. And Mamatoto is always here to guide you and to mother you, you're right, in this parenthood journey. So one thing is, let me start with breast milk production. And for anyone who is joining us here and is a medic, I just want to drop that hat and let me talk to mothers and fathers in a very layman's language, all right? So, breast milk production in every human or female depends on three things: just your mind, your baby here, and your breasts. Your baby will communicate its needs to your breasts, and your breasts will communicate the same to your brain. Let's call it a cycle of BBB. Baby, breast, brain. Brain, breast, baby. All right? So when it comes to the first few days, your body already started producing milk just from pregnancy. It's just that it has not started coming out. But to some mothers, I know of many mothers whose milk start coming out in time from 28 weeks and above, all right? Those ones they probably feel that like, I'm ready to feed my baby. I'm ready to feed my baby. Hi, Anna Kama, thanks for joining and you're doing a good job, all right? But some mothers, even after they give birth, like a day or two, they feel and they are afraid that they do not have enough milk. Some of the mothers will look at the breasts, express a little, and see some whitish or clear discharge. That is colostrum. That is milk. That is food for your baby, and that is what your baby needs at that particular moment. All right. So going back to our cycle is, the more you bring your baby to the breast, ananyonya sana, ako kwa matiti, is the more your body will produce. Allow me to use this example that I've always used when I'm talking to the mothers. If you opened a kiosk, for example, in your estate and you're selling milk and bread and some exercise books, and you realize that in that particular kiosk, your customers are always buying bread, what will you stock? You definitely stock bread. So that is the same as our bodies. The more the baby comes to the breast, the more our bodies will produce milk. It's a cycle, it's that curve of demand and supply. The more the baby demands, the more your body supplies. Parents, I want us to appreciate our bodies. I want us to really appreciate our bodies. Look at your baby. Just admire how beautiful your baby is. Let me tell you, you were able to create the bones. Your baby, the skull, the spine, the two hands, the two beautiful legs, all these are bones. So, Jameni, your body will not be able to produce enough milk. Thank you. So if you have that right inside your heart and you believe your body can do it, all you need is a positive mind and positive support system to tell you, just keep bringing your baby to the breast. All right. The other way that I want to give a clear example of a breast and production is the more your baby is on the breast, the more your body produces milk. And our breasts are not like this container here. This container is a glue container that the glue is done. There's no glue inside. Oh, kidogo too, but there's no glue inside. Once it's done, it's done. We have to purchase another container of glue. But our breasts are just special. The more it's emptied by the baby, the more mtoto ananyonya and the breast becomes empty, the more your body produces more milk and more milk. You'll even question like, how come when I express or pump more, the more my body makes more milk? It's because your body sits down and is like, huh? Why are we feeding twins here? Okay, let's behave. And then your body will behave. Your body will go to a shock and style up and produce more. So you're expressing and saving it for a rainy day, especially when you go back to work and the baby is still feeding and your body keeps on pushing itself to produce more milk. How amazing. Just how amazing can that be? Just how amazing. So it's all about trusting our bodies and knowing the right thing. So remember our cycle? For the ones who are joining us, we are talking about our brain, our boob, and our baby. So let's start interfering with this cycle, this beautiful natural cycle. So let's get the baby away. And we remain with the breasts and the brain. So who is creating a demand here? So by removing baby, probably we've given baby uji or formula or milk or water. So our baby is full. The small tummy is full. So this tummy will not come to demand for milk on these breasts. So our cycle is not complete. All right. So let's bring the baby, but we remove the breast. The breast is in between, is the connecting factor of the brain and the baby. All right. So we've removed the breast. We are still feeding baby with something else. So the baby is not coming to the breast at all. So our body is just there waiting for a signal to bring more milk, and it will not bring milk. Let us now go to the beautiful brain. So what happens to the brain? Mommy, you are stressed. Probably you're wondering, am I producing enough milk? Is my baby gaining weight? I saw my neighbor's baby is way bigger than my baby, and yet my baby is a few days older. You are stressed of, no, this is COVID. Should I go for clinic or not? Should I call somebody to bring for me immunization in the house? Your mind is not there. So you only have the two, the baby and the breasts. It's not going to happen. Daddies in the house, thank you very much for supporting your beautiful, beautiful, beautiful wives. And you can still do better. Sometimes when I like this technique that sometimes when the mother is expressing milk or breastfeeding and you just come and rub the shoulders, just give a nice rub on the shoulders. Maziwa hutoka, because it's just miracles, just nice and soothing, and you just feel supported. So daddies in the house, you can do that. The other thing, you can buy or you can hold a cup just beneath the breast, because whatever happens on the left breast happens on the right breast. So when the baby is feeding on this breast, what happens to this other breast? It starts in a mwaga maziwa. We call it a let down. So when there's a let down, you can help mommy by holding a cup and fetching this milk that is coming out, and we'll still feed it to the baby later. Okay, so when those factors are in place, now our milk production is even. All right. So the other thing is, but how do I still tell if my baby is having enough? I've tackled this question so many times, and I would want to give just in conclusion. Number one, your baby when breastfeeding, as long as the baby has a nice, beautiful latch, I call it like a bird, like a mouth that is wide open, takes the breasts, the lip outside, the lip is outside, the lower and upper lip, this shoulder. Let me demonstrate with my baby. So the ear, the shoulder, and this hip joint are inlined in one position. That's a very good attachment. And then mdomo imefunguliwa vizuri kama ndege, open, anashika matiti vizuri, so that our baby is able to latch and squeeze and squeeze and squeeze. So what happens to the baby? Mashavu iko. I don't know if you can see my mashavu nicely. Let me turn. Okay, and down here the baby is busy swallowing. And I don't know if I can do that with my bottle. Like I want to suck. And I'm swallowing. That is a baby who is having something na anameza. All right, we call it the suck and swallow, suck and swallow. And then when there is a letdown, your baby will just keep on swallowing. Is that nice voice that you will hear, because the baby is really just galloping and galloping because there's a letdown. Ashaskuma maziwa, sasa matiti ina spray, inatoa tu maziwa, so baby is just swallowing and swallowing and swallowing. That is number one. Number two, there is no way we can go to the washrooms if you've not been eating. So there's no way your baby is going to have wet diapers or poop, and yet your baby is not feeding. If your baby is having wet diapers, that means there's waste in the body. A good thing. So when it comes to poop, I'll discuss poop later, probably tomorrow. But when it comes to poop, I know they come this time around 4 weeks going up, where they poop once a day, or after every 2 days, after 3 days, some even go up to 10 days. But for a newborn, like I said, the first 4 weeks, at least you should get poop every day. It might be a lot, it might be just once, but it starts with at like 6 or 8, then it goes as the stomach also is able to hold for a while. The digestive system is also maturing up and can hold the waste a little longer. Yeah, so at least, but when you see poop and you see a wet diaper, that means your baby is having enough. Number 3 is a contented baby. A beautiful baby just looking at you and trying to figure out, where is this place? Just a baby who just looks fine, looks happy. And that's the time we take our time to admire our baby, and you're looking at, oh, whose eyes, whose kisogo, imiguni akina nani, So that time when your baby is not asleep, is alert and active, that one will tell you that your baby is having enough. So number 4, is my baby having enough? Is the common question that my baby is feeding so many times on the breast, and I'm worried. So parents call me and tell me, Shikari, this baby is on the breast all the time. And I'm like, that's a good thing. And the parent will be like, what are you saying that this is a good thing? So a baby who will be on the breast like between 8 to 12 times per 24 hours, that's a baby who is feeding well. This stomach here is a very small stomach that is supposed to feed and serve the whole of this body. So the baby will eat, the baby will drink, and then breast milk is amazing. It's easily digested, easily digested and easily absorbed by the body. So the moment the baby has fed, that food, that milk is easily absorbed by the body and serves this body. And guess what? No sooner than you get your beautiful sleep, your baby is back to your matiti. All right. So that is a baby who is feeding well. At least 8 to 12 times in 24 hours. That's a good feeder. That's a very good feeder. But then I say, all these things that I'm talking about is on average on the higher side of babies, but not every baby will behave like that. Some will even feed 15 times or 16 times. Some babies are tankers. We'll talk about all that now that we've started this. Some babies take milk and drink and drink and drink and drink, a lot of milk that will serve them for a while. Some just take a little to serve them for a very short while, and then they go back to your breast. The other one is a painful latch. If you have a painful nipple, here, this is the nipple, all right? If you have a painful nipple, that means your baby is not having enough. And when your baby is not having enough, you will not produce enough milk for your baby. Why? This nipple should never be touched by baby's mouth. If you get a nice latch, your baby will go to this black thing, this dark thing is called the areola. Your baby will be able to hold as big as it can and squeeze out milk. When your nipple is painful, this actually means that your baby is sucking the nipple. And that's why the nipple is damn painful, very painful. It's like when you're drinking from a bottle and you're using a straw and you're biting the straw. Definitely you will not have enough. So what will the baby do? The baby will get frustrated and sleep and wake up sooner than later and start crying and come back to your breast and also do the same. It continues, and then your baby just gives up and you're like, my baby no longer likes breastfeeding. Or you as a mom, even no longer, you don't even look forward to breastfeed your baby. So a painful nipple, just like I'll use my bottle here the same, when I bite it and I try to suck, there's nothing, I cannot get any water. So your baby should have a very nice latch. So if you have pain on your nipple, just know that your baby is not having enough milk and your body will not be able to produce enough. We talked about baby being alert. When your baby is alert, is not asleep, your baby is playing, your baby is active. Huyo ni mtoto ameshiba. Mtoto mwenye ako drowsy, we call it lethargic. Your baby is drowsy all the time. You can't know when the baby is almost sleeping and when your baby is from sleeping. You even rush to the hospital and they do all the tests, and there's just something. Sometimes unasikia the mothers will say aliongezwa maji. It's because your baby is not having enough. Mtoto mwenye ameshiba, an alert baby, is a very active baby. Very, just like the way they were active when they were when you were pregnant, they were kicking and playing and you could feel it and you were like, leo amecheza sana. That's the same way that our babies should be. So I think that's enough for today. I just wanted to talk about how to tell that you are producing enough milk. So in our next, this is just one of the very many. We'll talk about the poop color. We'll talk about the growth parts. We'll talk about how you should take care of your boobs. You should talk about expressing and storing your milk. We should talk about even birthing your baby. Let me know what you want us to talk about next. Mamatoto, childbirth, and breastfeeding services, we are here for you. It's essential service. We are working. We are doing the virtual video calls. We are still doing home visits, hospital visits, because we want you to get the best out of it. Thank you very much. I don't see any question, but if you send a question, DM or something, I'll get it and I'll get back to you. Thank you very much for joining and being here with us. All right.